So areas of application starting, we'll go superior to inferior in the home position. If this is grasping, kneading combined, where we're interlacing our hands like so, you can change the degree of how big of a circumference you're going to use by sliding your fingers one together, one apart. And so areas of application first is on the neck and shoulders. And so you have to make sense of how your hands are going to fit. Thumbs are up against the occipital ridge. The ulnar side of the palm is down the base of the neck. Hands are lower to the table, so they're deeper down. You don't want to end up being too high and pulling on the skin. If you start with you doing kneading and grasping combined, if you start to slip on the skin, that's where you need to stop your grasp. Just like this. So I grasp and then I knead towards the client's feet. So grasp and knead. Grasp the tissue, lift up, kneading down and out towards the client's feet. And here this is mostly body weight when I'm doing my knead towards the client's feet. So I'm just leaning forward. So grasp and knead. Grasp and knead. So it's grasping, kneading combined on the neck, shoulders. Next, grasping, kneading combined is going to be working on the triceps group. So here we'll work from the shoulder to the elbow. It feels a little awkward or unnatural motion if you try to work from the elbow to the shoulder, but you can try it if you'd like to. I'm not saying that you can't. I'm saying that it doesn't feel as natural. So same thing here. I'm starting at the shoulder. I'm getting into a squatting position, and I'm starting to grasp and knead. The direction of your knead, though, is towards the shoulder. So you grasp and knead, working from the shoulder to the elbow. I'm going to slide back up, grasp, knead. Now, if you want to get deeper with this grasping and kneading, you're going to use your thumb. You're going to tuck your thumb in like so. You're using the proximal portion of the flange from the proximal to intermediate knuckle. And here, just make sure you're not pressing into the humerus, that you're getting around the muscle and lifting the muscle away from the bone. So it looks like this, and grasp, and this will just be a little bit deeper. And this is, again, grasping, kneading with hands interlaced. And so next, area of application is going to be working on the client's back. You can work either direction. Dr. Joe typically will stand at the side of the table like so, and will work from thoracic to lumbar. There's a second position where you could stand at the head of the table, and you can work either direction. So you go lumbar to thoracic or thoracic to lumbar. I feel that it's a little bit easier position here, but you can try both ways. Now, instead of using the heel of our palm, now we're going to be using the ulnar side of the palm. So all other kneading, grasping combined when we do in the triceps, the neck and shoulders, the quadriceps, or the gastrocnemius is in this position. Now when we work on the back, then we change to this angle. So we're using the ulnar side of the palm because this doesn't make sense in body mechanics. So we work like this. Ulnar side of the palms are on the outside of the erectors. You gather as much tissue as you can. So here's the grasping portion, and then knead up and out. So grasp and knead, grasp and knead, grasp and knead, grasp and knead. Yep, kneading towards head in this position. And then you just slide back up to the top. And if when we're working through clothing, if someone's shirt is riding up, whether it's chair massage on the table, just take and pull it down. Back. And restart your particular move. Now this is grasping, kneading. You can go either direction, same thing, but I'm using the ulnar, again, the ulnar side palm. Position where you want to be. Don't stand back here because you're going to end up leaning and straining your back. Here, it's okay to brace up against the table as you work forward, support your body weight. So you can start here and then lean forward, just watch out. You're not running into the client's head. So you're going to go from lumbar to cervical. You're going to go the other direction. So now the knead is towards the feet. when you're standing at the side of the table, it's very awkward to go from lumbar to thoracic. So that's grasping, kneading on the back. Generally, we do on either side of the erectors. This would be along the bladder meridian that you're working, musculatures, erectors, you'll hit the upper and lower traps, and then you'll hit some of the QL and rhomboids as well as you're working downward. And then before I move to grasping, kneading combined, we have grasping, kneading with hands separate as well, and that was specifically on the neck, working on the upper traps. That's the main musculature. You'll get some levator scapula as well. So your two options are to do with fingertips to thumb. It's really important that through the musculature, your thumb is going to line up at least with your index and middle finger. So when you grasp, if you're misaligned, you'll end up sliding and pinching the skin. So the idea is you're going to grasp the muscle and then lift it away from the body. And depending on how much muscle people have, that will change how much you can actually grasp when you need. So you can go from medial, lateral, lateral, medial.
Yeah, because the client I did from this past Wednesday, absolutely no neck.
Oh. If there's nothing to grasp like that, if their traps are that thin, you can go down to 2 fingers, or you, in that particular case, it might make more sense to use a different technique. So you always want, anytime you're using a technique, some techniques don't make as much sense for one person as the other person, depending on your hand size and what their body's like. So here, it's alternate. So you're going to grasp, lift, and knead. So this is grasping, kneading with hands separate. And you work all the way out to the lateral end of the trap, so you're getting close to the end of the spine of the scapula, not quite to the acromion process. So again, this is mainly for the trap. If you want to work up into the neck, see, you can make your knead a little smaller and really work into those insertions along the occipital ridge here. You don't have to do that, but it's an option if you want to. Yep. You can go in and out. You could you could go from medial to lateral and then slide back in if you want. I like to go both directions when I do this technique. So, I mean, there are some minute variations that you can add in when you do a technique. Now, next is the same thing, except now we're going to use the edge of our knuckle here, again, this portion, and you just get a deeper grasp. So this is grasping, kneading with hands separate. You do have to lean over the table for this particular technique because this is the only position to stand in to do. So that's grasping, kneading with hands separate. Now with the knuckle instead of the thumb. So next, I'm going to move to grasping and kneading. I feel this falls like in between grasping and kneading as well. This is for the QL, specifically quadratus lumborum. This is where you're going to overlap your thumbs. Your thumbs should not be separate, they'll overlap. And then it should be a middle, to ring finger overlap.
Show the back of your thumb again.
Like this. This is grasping, kneading. It should be under grasping and kneading for the low back or QL. So it should be listed. So it's like this. And then if your hands are big enough, if you have small hands and you have a large client, you're probably not going to get around the entire QL. But my thumbs are on the lateral edge on Jeff's left side, and my fingertips are on the lateral edge of his right. And so you grasp and knead. So there's a grasp. In this case, you're not grasping and lifting too much, just because that muscle is not going to lift, but there is a grasping element here. So this is the grasp, and this is the knead. And that's right over the QL. And then moving downward, last grasping and kneading we have with hands interlaced in a prone position is working from the knee to the heel. Since he has a shoe on, I'll skip the heel. You can work in this position from the knee all the way to the heel. A lot of times when I'm working, I'll just work the heel specifically with the leg on the table, grasping and kneading combined. So it looks like this. You sit on the edge of the table, and you're going to start just above the knee, and you're grasping with palms need, the direction of the need is towards the knee, not towards the heel. So I'm grasping and kneading downward. You can try grasping and kneading upward, but it's very awkward for your body mechanics. So you go from the knee. Now I'm getting up to the Achilles tendon. So that's grasping, kneading, then you just slide back down and restart your position. And grasping, kneading techniques are always a little slower and a little deeper. Like this would be too fast. And you can see it gets really choppy. Make sure you have smooth, complete motions. Okay, and then I'll have you flip and slide down so you're in this supine position. So now grasping, kneading with hands interlaced again. So we have two left. These fall specifically under grasping and kneading combined. And then after that I'll demonstrate just regular kneading. So here we'll work on the quadriceps group. Now when I'm working, I usually do this with a leg slightly flexed by putting a bolster or a pillow underneath the client's knees, like so. That just gives you enough elevation. So this technique makes sense standing at the side of the table. So here's how I usually do, starting at the knee, and then you just go with the drape line. So you're working on the quadriceps group. You can work specifically over the knee, like so. So grasping, and you can go either direction in this case, but the direction of the knee is towards the client's head. So grasp the knee, and then you can stop and work right over the knee joint as well. So that's grasping, kneading combined. You could do this on the table as well, but you have to have really good draping. In this instance, you have to do a diaper drape. So here's where we flex the knee a little bit more. You sit on the edge of the table and just brace the lower portion of the leg against your hip. And same technique, just a little bit different position. So that's grasping and kneading. Hands interlaced. And then last, grasping, kneading, we have is hands separate, and now coming back up to the head again. And this is for the shoulders, trapezius mainly again. Now, when this position, when the client's face down, we're working this way, fingertips line up with the thumb. But now you have to angle your hands in slightly to make sense of the way the musculature is laid out for grasping and kneading here. So, it's not necessarily quite straight down. You have to angle just a little like this. And so it's alternate. So I'm grasping the muscle, pulling towards me as much as I can, more body weight and muscle. I'm not really tensing up very much. And again, you just go from medial to lateral. And then you go from lateral to medial. So you go both directions with this one. The hand again is like this, grasping. So that's all of grasping and kneading combined. The only thing I didn't demo specifically on the heel, but I think that's pretty easy to figure out. And then I'll have you face down on the table again.
Ask the question too,
sure.
Because that was where for my client,
The quadriceps.
she couldn't handle that. Yeah.
Your options are, if it's too much for them, one, you could try to lighten your pressure and just do it really light, and if it's still too much for them, just do a different technique or work on a different body part.
Sure.
That's what I would try.
Or
Everybody's going to have their preferences, what they like, what's going to be too much. And sometimes, it could be, sometimes, a lot of people do believe in muscle memory. Muscles have memory. There's like other connections going on, and it looks like the modern science, neurosciences, and studies of the universe, and those sorts of things, and quantum physics, actually kind of alluding to this.
You also mentioned before, and I do this with clients, if there's a lot, I experience a lot of ticklishness, and I'll actually do a little bit deeper pressure, but I won't do the kneading. I just do more of a grasp and move, because oftentimes it's the kneading that creates the sensitivity or the pain or ticklishness.
I had to just stop. did all different things and then I just moved away.
Well, you can go back to it next time and
Yeah.
see what happens.
Yeah.
Right?
That's good.
So now we're doing kneading. This is strictly kneading. The kneading, you can use your fingers, palms, heel of palm, side of palm. You use your forearm. We use fists. We use flat of the elbow as well. And so kneading technique is deeper against lower. It's not superficial like rubbing. You want to make sure that you get firm enough with it that you're moving the muscle rather than just going over the skin. Okay. So here, this is 10-finger kneading on the head. And so here your thumbs are overlapped a little bit. That just creates more of a counterpoint grasp. If your hands are separate like this, you're going to have a really hard time generating pressure. This makes a big difference, putting your thumbs like this. And so you just pick 2 or 3 spots, so it's kneading. So you really can be pretty firm with this, some of those people. So you see how I'm moving my body a little bit too. It's not all muscle force. Just fingertips. It's more the pad and tip of the finger, so your hand shouldn't be like this. Your palm should be resting on the client's head, not away from them. So that's 10 fingers on the scalp. So next I'm going to go to kneading with 4 fingers along the occipital ridge. You can do one side and then the other, or then you can add in alternating. That looks like this for one side. I'm working on Jeff's left side. Underneath the occipital ridge, getting in the suboccipitals and also getting into some of the insertions for muscles running from the occipital ridge into the upper back. So this hands overlap. You need under the occipital ridge, but then you could also need on. And the direction is I'm going away from the spine. I'm not kneading towards the spine. I'm going away from the spine on both sides. So there's one side, there's the other side. Or if you want to alternate, see, it's like this. Okay, so that's kneading with 8 fingers now on the occipital ridge. So next, I'll go to kneading with palms on the shoulders. So here you're working on the upper traps, levator, scapula. You want to get your palm lower. This is too high of a placement for your palm because you're just going to be pushing more on the skin and the scapula rather than pushing on the muscle. So here's the muscle you're pushing on. Your palms are deeper, and direction of kneading is outward on both sides. I think that's easier for me to say than my right hand's going clockwise and my left hand's going counterclockwise. It's just your knee should be outward. So step 1 is apply pressure, and then step 2 is start to lean your body weight forward. You shouldn't be tensing up at your shoulders. So pressure's on my left. I'm coming off on my left and starting pressure on my right. There's always a little bit of pressure, but with a lot of between on, there's the ebb and flow between pressure being on and pressure being off with most techniques. So that's kneading with the heel of the palm. You're actually getting more of the full palm in there, but a lot of the apex of the force is along this line that the whole palm is touching. So that's with palms, and now we go to kneading with fists. So with kneading with fists, we start at the top of the shoulders, and then we change angle and work into the neck. When I'm working on the top of the shoulders, I'm using the proximal to intermediate knuckle mostly. You should have a loose fist, but the fist should open up as you knead some, and that allows for your wrist to be loose, because if you're trying to knead like this, you have no mobility in your wrist. So that one looks like this. Body weight first. And the position of your hands is at the base of the neck, moving out into the traps, levator, scapula, but you're not kneading your knuckles into the spine of the scapula. So kneading shoulders. Now the next part of this particular move is you're going to start kneading now towards the neck. So when we knead towards the neck, so top of the shoulders is proximal to intermediate. Now into the neck is from your intermediate to distal knuckle. And so now we're also moving our fingers as we knead. Now the direction of the knead is inward and towards the occipital ridge. So the direction direction of pressure is this way, and then a little up. And when you do this, you don't want to actively extend your thumbs. Just let them rest. Okay. And so then what you want to end up doing is be able to switch back and forth. Shoulders. And then neck. I'm going to go to the neck, see I lean my body weight back slightly. I'm going to go to the shoulders and lean forward. Better not. You want to try to stay as straight as you can. So that's kneading on the neck and shoulders with knuckles going back and forth between the two. And then, what did I? Alternate knee with palm shoulders, knee, fist on. Okay, so alternate kneading with fist on low back and then palms, just looking at the sequence once you're on the board. So now you're going to stand at the edge of the table or the side of the table. My preference is to stand here. If you stand too far back, you're not going to really get downward pressure into the low back. So you want to try to get your body weight a little bit more over the client. Dr. Joe typically will be like this. When he does technique, that's fine if you want to stand that way. I would try and see what's more comfortable for you. This position is most comfortable for me. And so when you're kneading with this, it's the same, it's pretty much the same as being on the shoulders, except you're changing the plane of your fist. When we do the neck, it's like this. When we do low back, it's like this. Neck is like this. Low back's like this. Neck, low back. And so then you still want to keep loose. Direction of pressure is down towards the floor. And then you can add a little angle going towards the feet, but down first. So first step is to get your body weight into the client. And the second step is to start to knead. And see how the hands open up slightly? That allows me to have my wrists loose. Because I'm trying to knead like this. See how rigid my wrists are? When you open up the palm a little with the part as part of the motion, that will help you to be more relaxed at the wrist and in your shoulders. So that's kneading with knuckles. Now we're going to go to kneading with palms. So now you're using more of the heel of your palm, this portion when we're working. And what you're going to do is you're just going to let your fingers relax like so. You don't want to have them extended. Just keep them under the client's glute. This is fine like this. But now the position that you're in is right through here is the posterior iliac crest. So you're getting your palms just slightly above that, but also slightly on it. So it's like you're kind of hitting the edge of it and pushing downward. Now the direction of pressure here is, I would say, more like a 45 to 60 degree angle this way instead of straight down. And when you do this technique, you should see the feet move. This will help to mobilize SI joints as well. And you can move outward a little if you'd like. You can move inward a little. There's not a whole lot of room to move around here from medial to lateral. So that's kneading with the heel of the palm. So then next, then forearm kneading on the back. So you're going to use, whoops, I'm sorry, I missed kneading with palms on the back. So next is palms. So if I'm going to knead with my palms, you can knead with one palm if you want, but generally when we're kneading with palms on the back, we're going to have our hands a little overlapped. I would recommend having your dominant hand in contact with the client. In the end, it really doesn't matter, but when you're starting out, having your dominant hand in contact usually is a little smoother. And so positionally, here you work from across the table instead of the same side of the table. So you're getting the muscle and pushing it away from this, kneading it away from the spine. So right now, the heel of my palm is on the rectors, maybe a little bit inside the laminate groove. And so now I'm going to overlap and get my body weight down. And so I knead and then relax slightly as I move to the next spot. And when I knead here, this is my main contact, but I am getting part of my, the hand that's on top of my hand with direct contact and leaving part of the heel of the palm with it. So with kneading, you can stay in one spot for a while if you want, or you can move with every knead. I usually do 2 or 3 if I'm just doing general work. And now my palm is in between the spine, and I can feel the medial scapula. And you can go either direction. So you go from superior to inferior, maybe now, the other direction. So then when you work on the opposite side, then you would have to walk around to the other side of the table. I mean, you can try kneading on the same side, but it just kind of feels like you're not catching the body weight and there's not a whole lot of motion. See, when I work on this side, I get my body weighted down. See how it starts to shift at the hips a little bit. When we do pressing technique, we're not doing that yet. Pressing you can do on either side, standing at the table, but kneading is a lot more comfortable in this aspect doing on the opposite side. Then we have kneading with forearm on the back. So your right arm is going to work the client's left side. Your left arm will work the client's right side. Just for body mechanics, it really doesn't make sense to knead this way. It's pretty difficult, so you use your right arm on the client's left. You start in between the medial border of the scapula and the spine, and you can, get a little bit of the upper trap here as well. I prefer to knead away from the spine. You can really knead either direction towards the spine if you'd like. You can try it both ways. A lot of times I'll see Dr. Joni's kneading towards the spine. Personally, my preference, is I, like kneading away from the spine. But it doesn't matter which, neither one is wrong. And when you're kneading with your forearm, see, you're not rolling the forearm, you're just rotating your forearm as you knead. I put my other hand here to control my body weight rather than on the table. When you put your hand here on your hand around your wrist, it gives you a lot more control of your body weight. So you knead from superior to inferior. Just watch out for your elbow hitting into the spine. You can always shift your angle a little bit. You have a little room to play. When you start up here, you do have to have your arm in line with the spine, so you can fit it in between the medial border of the scapula and the spine. But as you move downward, you can shift some if you'd like. And then if I was to go to the other side, I would just switch arms. So that's kneading with a forearm. And then last is cross palm or butterfly kneading. So this one will take some coordination on your part. The way that this particular technique works is I would recommend having your left hand on the opposite side, your right hand on the same side. There's no reason you can't switch it, but generally it seems easier with the curvature of the back to have your left hand on the opposite side. Like when you put it back, curves and gets down on most people. So my left hand is on the opposite side, going in a counterclockwise direction. It's going to be going this way, starting more with the heel of your palm and then transferring to more the ulnar side of your palm. My right hand is going to be on the same side, but it's going to be underneath or crossed underneath. So if you have your hands separate like this, you actually have to have them crossed. The idea is your fingertips are going to be moving towards each other from one side to the other. So I think that's an easy way to think about it in your mind. Those fingertips are moving towards each other. So my right hand is going to be going in a clockwise direction on this side of the table, moving towards the spine. So when I put it together, it looks like this. And you need to have enough body weight in there to move the muscle. So I do add, I move my body with the motion. It doesn't have to be exaggerated. What happens if you don't move your body is you just kind of end up going over the skin like that. You're just sliding. So you're going to try to catch the muscle. You go either direction. So that's cross palm or butterfly kneading. Any questions? Oh yes, yeah, that's right. So if can I pull your shirt up? Yeah, absolutely. Okay. You can just pull it up for this, so I can show exactly where I'm at. Okay, yeah, that's fine. And see, this is what you want to see even working through clothing. You want to see the back turn pink, so that would signify that you're getting blood, to the surface of the body as you're doing technique. So next, what I demonstrated is this is kind of cross thumb. There will be a cross thumbs grasp where we only grasp, but I like to add a little bit of a knead into it as well. And this is working along the spine on either side of the spine in the laminal groove. And your thumbs are working in and in between the transverse process of the spine. So it's a little staggered. One thumb's on the spinous process below, one's on one above. So when you actually squeeze, you're helping to mobilize the spine. Or when you're grasping and then doing your knee, you're helping to mobilize. And you have to get deep enough down that you can actually, you should be feeling the spine on either side. Now, some people, when they're really tight, you're not going to be able to feel that, but on some people, you will be able to. And so that it is like this. I'm standing at the side of the table, so you have to lean over. I'll demo too where we can stand at the head of the table. So it's like this. So fingertips are for support. I'm getting my thumb, so you're putting body weight down, getting deeper into the spine, and then you just move your way up. If I had a little oil, then I could slide instead of have to lift slightly, but I'm still keeping contact with the lift. So it's kneading and grasping with thumbs. It's a little easier if you stand at the head of the table because then you don't have to lean as much into it. And so you need to move up with it so you're not reaching too far. So you can see the thumbprints for bring the blood to the surface there. So you can also stand at the head of the table. If you're standing at the head of the table, you work from cervical to lumbar. It doesn't make sense to really work back this way. So like this. Now here I can slide a little bit. Until you have a lot of strength in your thumbs and know how to use your body weight. This does take thumb strength, this particular move, because you really have to get deep enough into the lamellar groove. So when you're practicing this, things where you're using your thumb at first, don't overdo it. If your thumb's starting to hurt, work it out a little bit and then take a break.
Is that where most of the strength is coming from? Is your thumb?
Most of it's my body weight, but to actually grasp and squeeze on the spine, that has to come from your thumbs. There's no way around that.
Is there a lot of pressure?
I'm doing a lot.
Your thumbs?
Oh no, just the thumbs.
Okay.
In this particular aspect. Okay. But during a massage, you would only do this, 2 or 3 times moving on the spine if you're going to be doing it. So it's not like you're going to be doing this for 10 minutes. So you just vary technique. Some techniques will take a little more effort on your part, but most of the techniques we learn are pretty easy to do with body weight and body mechanics.
You usually would do that if you have problems with their spine or muscles around the spine.
Yeah, I would work